In 2026, one word is suddenly making many people uncomfortable again: hantavirus. It sounds unfamiliar to some, frightening to others, and almost unbelievable when we remember where it usually begins. Not in a laboratory, not in a crowded city street, not from a stranger coughing beside you, but often from a place much closer to home: a garage, a basement, a shed, a cabin, a storage room, or any quiet corner where rodents may have been living unnoticed. Hantavirus is often called a rodent virus because humans usually become infected after contact with infected mice or rats, especially through their urine, droppings, or saliva. The danger is not always a bite. In fact, many infections are linked to tiny contaminated particles that can become airborne when people sweep, vacuum, or disturb dried rodent droppings. That is what makes this virus so unsettling. You may not see the danger. You may only think you are cleaning an old room. And that is why today's video is so important. Hantavirus does not spread like a common cold in most situations, and most people will never get it. But when it does infect someone, it can become serious very quickly, especially when it affects the lungs. The early symptoms can look ordinary, almost like the flu. Fever, fatigue, muscle aches, chills, headache, dizziness, stomach discomfort, nausea, vomiting, or diarrhea may appear first. At that stage, many people may think they simply caught a seasonal virus or ate something bad. But the real danger begins when breathing becomes difficult. In severe cases, hantavirus can lead to a condition known as hantavirus pulmonary syndrome, where fluid builds up in the lungs and the body struggles to get enough oxygen. This is why early medical attention matters. If someone has recently been around rodents, cleaned an area with droppings, opened an old cabin, worked in a barn, entered a dusty storage space, or handled materials that may have been contaminated, and then develops flu-like symptoms followed by breathing problems, they should seek medical help immediately. One of the biggest mistakes people make is thinking that a clean-looking house means there is no risk. Rodents can enter through tiny openings, hide behind walls, move through attics, and leave droppings in places we rarely check. A garage full of boxes, an unused room, a garden shed, or a vacation cabin closed for months can become a silent risk zone. The virus does not announce itself. There is no smell, no warning sign, no obvious alarm. Another mistake is cleaning rodent droppings the wrong way. Many people grab a broom or a vacuum because it feels normal, but this can push contaminated dust into the air. The safer approach is different. Ventilate the area first if possible. Avoid stirring up dust. Wear gloves. Spray the droppings and contaminated surfaces with disinfectant or a bleach solution. Let it sit, then wipe carefully with disposable materials. After that, seal the waste properly. Clean your hands well and wash or dispose of anything that may have been contaminated. Prevention is not about panic. It is about simple habits that reduce risk. Seal holes and gaps where rodents can enter. Store food in strong closed containers. Do not leave pet food exposed overnight. Keep garbage covered. Reduce clutter where rodents can hide. Be careful in rural areas, cabins, sheds, barns, and places that have been closed for a long time. If you see droppings, nesting materials, or signs of rodents, do not rush into cleaning as if it were ordinary dust. In 2026, hantavirus is also getting more attention because some strains, such as Andes virus, have been linked to rare person-to-person spread in close contact situations. But it is important to stay calm and understand the difference. Most hantaviruses are mainly linked to rodents, not casual human contact. Andes virus is a special case and is mostly associated with certain regions of South America. This means the general public should not treat hantavirus like COVID or the flu, but people should still respect it because it can be severe. The people who may need to be especially cautious include those who work or spend time in places where rodents may be present. Farmers, cleaners, construction workers, campers, hikers, people opening old buildings, and anyone living near rodent activity should take prevention seriously. Seniors and people with weaker health should also be extra careful because severe respiratory infections can be harder on the body after the age of 60. So what should you watch for after possible exposure? The first signs can appear days or weeks later, which makes the connection easy to miss. Fever and deep muscle aches can be early clues. Some people may feel unusually tired or weak. Others may develop stomach symptoms. But the symptom that should never be ignored is shortness of breath, chest tightness, or difficulty breathing after possible rodent exposure. That is the moment to stop guessing and call a medical professional. There is no simple home remedy that can cure hantavirus. Drinking herbal tea, taking vitamins, or waiting it out is not enough if serious symptoms appear. Treatment is mainly supportive. which means doctors focus on helping the body breathe, stabilizing oxygen levels, and managing complications as early as possible. The earlier someone gets care, the better the chance of recovery. This does not mean you should be afraid of every mouse you see. Fear does not protect you. Knowledge does. The real protection comes from knowing where hantavirus hides, how exposure happens, and how to clean safely. A few careful steps can prevent a dangerous mistake. Before you continue with your day, think about the places around you. Is there a garage you have not cleaned in months? A storage room with old boxes? A shed with signs of mice? A cabin that has been closed for a long time? These are the places where caution matters most. If this video helped you understand hantavirus more clearly, share it with someone who cleans garages, works outdoors, camps, farms, or lives in an area where rodents are common. And tell me in the comments, have you ever found mouse droppings in your home, garage, or storage room? Your answer may remind someone else to be more careful. Remember, hantavirus is rare, but it can be serious. The danger is not always loud. Sometimes it begins quietly, in dust, in droppings, in a forgotten corner of the house. In 2026, protecting yourself starts with one simple rule. Never treat rodent contamination like ordinary dirt.